is all I'm taking. Could I just first of all welcome the debate. I know we've had a number of debates here on the area of mental health, but I think what's really important is not so much that we debate, but that we ensure that there is actually action and that there is implementation with regard to Vision for Change, and indeed with regard to specific and deliverable developments in the area. And I do think funding is important. I do think ring-fencing funding is particularly important. And I would refer to Kathleen Lynch when she was Minister in charge of mental health. She insisted on having a ring-fenced budget because there had been a tendency for money allocated to mental health to be taken back into the general health budget. And I do think it's important that money is ring-fenced, and I do think it's important that money that it has been allocated specifically for mental health, that it actually is spent in that area. Because to suggest now that somehow or other money that was to go to that area in 2016, and indeed a similar amount for 2017, that somehow or other there will be a cut back in that or a reduction in the amount, is sending a signal to the services that they're not going to continue to develop in a way that ring-fenced money was used in recent years. And what had to be done in the whole area, following on the Vision for Change and the way in which a Vision for Change set out much more focus on prevention, on community services, rather than the old idea that everything had to be done in acute services, that everything had to be done through psychiatry rather than areas like counselling. And particularly, I think the fact that so many people did feel that they couldn't talk about mental health, that they couldn't go forward and say, I have an issue around mental health. The whole mindset and so on needed to be changed. But I think particularly the rebalancing of the services to local community care and providing alternatives to the kind of very much acute care-based model that we had before. So when the money was ring-fenced, it was used to areas like supporting community organisations, like working on suicide prevention, educating GPs on suicide prevention, a primary care counselling service, access to psychology and psychotherapy services, additional beds for CAMHS, clinical nurse specialists to respond to those who present with self-harm in accident and emergency departments, a national clinical programme for eating disorders, which was an area that had been very much neglected, and training in behavioural family therapy, and indeed the rollout of Jigsaw, which has been referred to by a number of previous speakers. The Jigsaw, I think, is a very good example of a service that is welcoming, that is accessible to young people in particular, and I think that is very much an example of the way we need to go. And I do welcome the fact that it is being rolled out, though it needs to continue to be rolled out. And I know that Limerick and Cork indeed are areas that are targeted for the present. But I do believe that we need to continue to roll out that particular service. I had the opportunity to see it in action in Galway and was really impressed. But even talking to young people, that is what they want. They want to be able to access a service that is open to them, but also that they don't necessarily need psychiatry, that in many cases what they need is other models like, for example, counselling. And indeed, I think from the research that was done in relation to young people presenting, that very often that was the kind of service that they required, and not, I suppose, the more traditional service that had been available in the past. So I suppose the case I particularly want to make is around the need to ensure that counselling service in primary care, that is put out to young people. Now, I know that there has been a delivery of a service for adults, but it needs to be available also to younger people, and that we have the kind of community services that Jigsaw is one example. But there are many community organisations right around the country that are doing great work in terms of community support and of bringing the mental health services out to people in the community and letting them know what's available. And I do believe that they need to be really well supported as well. I think having the debate tonight around the funding is important, because if we don't ring-fence the funding, then inevitably it will be spent in other areas. And I wish the Minister well with that, and I do think that she should have the support of her colleagues in government to ensure that the funding is kept in the mental health budget. And I know that there's been issues around recruitment, but I think a lot of that has been addressed, and there is a capacity, I think, to recruit now that perhaps wasn't there back in 2011. And the government needs to ensure that it continues the efforts to recruit staff and to broaden things out into the community. I want to say a little bit about the educational area. It was mentioned by a number of speakers as well, because I think there is much more of an emphasis now in the education system in the whole area of mental health and well-being. And one of the areas that we concentrated on in the reform of junior cycle was to make well-being a compulsory subject for the junior cycle, and that's due to be introduced next year. And I think that is a way of ensuring that all young people get the opportunity to talk about their mental health, to talk about well-being, and to recognise that it's a part of life that sometimes you don't necessarily feel all that well, but that you need to recognise that there are places you can go, that there is support, and that it's okay to talk about it. So I think there's a cultural change needed, but there's also the very practical measures in terms of what is to be done in the Vision for Change. And we need to ensure that the money is there in order to implement these programmes, and particularly the programmes that provide access in people's local communities, in their GP service, in their primary care services, so that they can seek help and get it when they need it, not at a stage when they've been suffering for a period of time but haven't felt that they either knew where to go forward or who to go forward to. So it's a welcome debate, and I believe that we need to continue to raise issues around mental health, because it has been an area that has in the past been neglected. But I would say that in the previous government, and indeed I hope now continuing in the current government, that emphasis that was brought about by the ring fencing of funding, that will continue, and that we will continue to strengthen our mental health services, and particularly to make them accessible. Thank you.